so neck, yeah, flexion, extension, hyperextension, lateral flexion, rotation. Good, okay. Then shoulders, abduction, adduction, then flexion, yeah, extension, hyperextension. Good. Then with elbows, flexion, extension, then rotation. Okay. Then with the wrist, flexion, like wrist out, yeah. Flexion, extension, hyperextension. Then you have next to you, so pinkies in is ulnar flexion, and then thumbs going out is radial flexion. Then fingers, abduction, adduction, flexion, extension, supination, pronation.
So for your hips, we have abduction and adduction, and rotation, external rotation and internal rotation. Then we have flexion on your hips, extension, hyperextension. Then for your knees, we have flexion and extension. For ankles, we have eversion and inversion. And you have dorsiflexion and plantar flexion. So for toes, we'll do flexion, extension, hyperextension. So we have a couple of tips for you guys to remember all of these range of motion names because they can be a little bit confusing. So first, with flexion and extension, we do those movements for a lot of different joints throughout our body. A way to remember this is flexion is a more comfortable way to put your joints in those positions. When you go to hyperextension, it's normally a little more uncomfortable. You have to kind of force your joint into it. So for example, with our wrists, when we do flexion and we bend our wrists in, that's pretty comfortable for us. But when we do hyperextension, you kind of have to force your wrists into those positions. It's more difficult to get in. And you can do that with any of them. Even with like your legs, hyperextension is farther back, flexion is more in the front. That's more convenient for you. Normal extension, when it's just extension, it's just how your body lays when you're standing normally. So my wrists are extended, my shoulders are extended, my hips are extended, my head is extended. All of my joints are in an extended motion right now.
Okay. For abduction and adduction, those can be confusing. Abduction is moving away from the center of the body, and then adduction is going back towards the center of the body. The way I always remember this is I visualize, okay, if someone was being abducted, right? Like abducted by aliens, what kind of movement would they make, right? If you're getting abducted, everything's gonna move apart. You're kind of doing this motion, being abducted, away from the center of the body. Versus adduction is the opposite. So everything's coming back in, it's being added to your core. So that's just a funny way to remember.
Okay, one more tip. So for supination and pronation with your wrists, right? So that's two different positions. This one can be kind of tricky too. So for supination, think about when your hands and you're holding soup. So if you're asking for soup or if you're holding soup in your hands, you're gonna do it this way. So this is supination. And then pronation is the opposite. Throw your soup on the floor, pronation.
Good luck.